There we are. Look at you, mister. Can you make it all the way over here?
When it comes to 4-year-old Julian,
Yay, you made it. High five. That's right.
it's the simple things his parents look forward to.
Do you like this book?
Yeah.
Because taking care of Julian is anything but simple.
Giving him a bath, taking proper care of his trach and his G-tube site, changing his trach ties. Do you want to play with your toy cars?
Elisa's Julian's mom.
His birth was actually the funniest one because it was the least complicated of all the pregnancies I had.
At 2 months old, Julian came down with a virus.
I took him to the ER, and then he stayed in the hospital for 6 months. An anglerfish.
Doctors diagnosed Julian with an axonal neuropathy, among other things. He can't walk or sit up.
He's a baby.
One of his vocal cords is paralyzed. Julian's fed through a stomach tube and breathes with the help of a ventilator.
I love him, and he is the most positive thing.
Elisa and her husband have health insurance through the military. They're also Medi-Cal approved for home health nursing. Elisa says Julian is approved to receive nursing care 22 hours a day, 7 days a week.
Right now, we get about 8 of that.
Somebody should be here helping you all but 2 hours of the day.
That's correct.
7 days a week.
That's correct.
And right now, they can only cover 8 hours a day?
That's correct.
Health advocates tell Team 10 there's a shortage of licensed vocational nurses. Not in the profession, there are nearly 100,000 people with current licenses in California. They say the shortage is partly because of out-of-date Medi-Cal reimbursement rates. It makes it difficult to recruit nurses with the right skills willing to work for less.
Right now, the reimbursement rate is $29.41. Experts say after all the cost of doing business, nurses are only making around $18 to $20 an hour. If they took their skills elsewhere, they say they could be making 2 to 3 times that.
No, thank you.
Team 10 discovered one of the Medi-Cal reimbursement rates used for Julian's care hasn't been increased in more than 16 years.
It hasn't kept pace with the cost of living, hasn't kept pace, frankly, with supply and demand.
Brian Mainshine is Elisa's state assembly member.
Is the state doing enough to help these families?
I don't think so. I think there's more that can be done.
He's proposing a bill that would increase the Medi-Cal reimbursement rates, something that was tried last year. But this year, Mainshine is the vice chair of the Committee on Health. He would have more power to push the bill forward.
If we can increase that payment reimbursement rate where they're getting paid for taking on these very difficult cases, more of them will.
Hi, Mommy.
Yes, hi, sweetie. Hi.
Hello.
That would be welcome news to Elisa, who quit her job to cover the hours nurses can't.
It reminds me every day, you know, the miracles of life and how positive life really is.
And Elisa started a petition to Governor Brown titled "Give Home Health Nurses Fair Pay." More than 18,000 people have signed it so far. I asked the governor's office if he's seen it. So far, no response.
So if state lawmakers increase the Medi-Cal reimbursement rates, will that cost taxpayers more?
It might actually end up saving taxpayers some money. Julian's already at home, but his politician says there are kids still in the hospital setting because they can't get the help at home. He says take them out of a more costly system, bring them home. It will reduce the cost.
Wow, it is all about supply and demand.
Yeah, it makes sense. All right, Adam, thank you.
Thank you.